As we all know, tobacco is one of the most important reasons for head and neck cancers. But of late, doctors around the world are witnessing a major shift. More and more patients diagnosed with head and neck cancers have never smoked, never chewed tobacco, and never consumed alcohol. So, what's changing? The most important culprit is HPV. Hi, I am Dr. Bhaskar Reddy, Consultant Surgical Oncologist at Speciality Cancer Care. Today, let us understand how HPV is changing the landscape of head and neck cancers. First, what is HPV? HPV or human papilloma virus is one of the most important viral infections around the world. In fact, most people will be exposed to HPV virus at some point in their lives. For the majority, body's immune system clears the virus naturally without causing any long-term problems. However, certain high-risk strains of HPV virus can persist in the body for years, and in some individuals, these persistent infections can eventually contribute to the development of cancers. Traditionally, when doctors observed oral cavity cancers, throat cancers, tongue cancers, and oropharyngeal cancers, the usual culprit will be either tobacco or alcohol. But over the last 2 decades, HPV-related oral cancers have increased tremendously, particularly pertaining to oropharynx, which includes posterior one-third of tongue, tonsils, and oropharynx. So, what makes HPV-related cancers different? The first difference is the patient profile. Many HPV positive patients are younger than what we traditionally expect in head neck cancers. Often, they have none of the classical risk factors associated with tobacco-related cancer. And the second difference is tumor biology. HPV-related cancers behave differently at cellular level. Surprisingly, this difference can sometimes work in patients' favor. In many cases, the outcomes in HPV-related cancers are better compared to non-HPV-related tobacco-related cancers. Of course, every patient, every cancer is different, and so are the treatment decisions. The decisions have to be individualized. Another challenge is awareness. Many people are not aware that viral infection can cause cancers and are easily preventable by vaccines at appropriate times. The next challenge is the early symptoms are often ignored. Persistent throat pain, difficulty in swallowing, a lump in the neck, changes in voice, or a sore ulcer that doesn't heal. These warning signs should never be overlooked. Early diagnosis remains the most important factor related to cancer treatment and outcomes. The conversation around prevention is also evolving. Today, HPV vaccination is recognized as an important public health tool. Vaccination has the potential to reduce the burden of several HPV-related cancer in the future. As awareness grows, experts believe we could see a significant reduction in these cancers over the coming decades. In head and neck cancers, the patient profile and the tumor biology is changing. So is our cancer awareness, which continues to evolve. That is why regular medical evaluation, awareness of symptoms, and early diagnosis remains critical. At Specialty Cancer Care, we combine multidisciplinary expertise, advanced diagnostics, and personalized treatment planning to provide comprehensive care for patients with head and neck cancers. If you have any persistent symptoms, do not ignore. Please consult our specialist at Specialty Cancer Care. Early detection can make all the difference.